Hey guys, Alex here. So, I've been doing some vlogs about the link between mental health and physical health. And you might have seen some of my other videos. I've talked about sleep and mental health, exercise and mental health, drugs and alcohol and mental health, nutrition, food. Um, the final one that I want to talk just briefly about is physical illness and our mood and mental health. Okay, so you have probably noticed for yourself that if you are sick, like if you've got a cold or the flu or something's going on, illness wise, you've got a bug or something's happening with you, it really affects your mood and your mental health, right? Um, People who experience chronic physical pain and chronic conditions, we know that they have much higher rates of depression and anxiety and poor mental health. So again, it's this link between the body and the brain, and it's all interconnected. So we want to be mindful, if our physical health is not great, whether it's something, really common like a cold or a flu, or whether it's something more serious, it is going to have an impact on our mental health. And so we want to be extra mindful of how we take care of that while we're managing that condition. So um, I'm going to assume that if you've, needed to go to your doctor to sort out what's happening with you physically, you've done that. Um, what we really want to focus on is allowing our body the time and the space it needs to try and recover as best it can, right? So if we're adding undue stress onto our system, it's going to promote problems, right? We're not going to get that recovery that we might need. I know for some people that having time off work when they're sick is not something they like to do or even something they can do. But if you can, just take a couple of days, like rest, give your body what it wants. If we push through, you might get through that week of work, but you probably just set yourself up for an extra week of feeling really lousy. Where if we maybe just gave ourselves a day or two to rest and refuel and recover, that our body might be able to heal more quickly and we don't sort of drag it on out. Um, in regards to eating, so again, if we're unwell, we'll often, not have much of an appetite. If you've got a flu, you know that, sometimes you can't keep stuff down. Thinking about just trying to graze, having small meals, high nutritional content, things like that. Again, a hungry body is a stressed body. So you may not feel hungry, but your body's still needing all the energy that it normally needs. So just trying to, stomach what you can, get a little creative with what you're feeding it. But if you need extra sleep, then sleep. If you need to rest, rest. If you, need to avoid drugs and alcohol for a couple of days, then do that. So really sort of, taking care of your physical health so that you can really recover and get better. If you are suffering from a more chronic health condition and that's impacting on your mood, have a really good chat with your doctor about that. And, get a doctor who really understands the impact of chronic health conditions on mental health, right? I have a few clients who have chronic physical conditions. A lot of them experience a lot of pain from those conditions, and they get some temporary relief. Sometimes they'll have surgery, and that will help for a while, or certain things will help for a while. But there's always this sort of underlying pain, and it's really stressful, right? It really, wears people down. So obviously, talk to your doctor. See if you're getting the right treatment, but also ask your doctor, what can I be doing to best encourage my body to heal, right? So I talked in my food and mood vlog about some research about nutrition and how that can promote healing in our body. Now, that's not to say that you can get rid of a chronic health condition. Let's take MS, for example. You can't get rid of MS with diet and exercise, but you can certainly do things to encourage your body to be the best it can be, right? Maybe slow the progression of things or reduce the severity of the symptoms, or maybe just you notice that your mood is a little better when you're physically treating yourself better, right? I talked about Dr. Terry Walls, who has a really good TED Talk, if you Google her, about functional medicine. So functional medicine is basically a field where we're discovering a lot about cellular function, right? So what we do to promote good cellular function in our whole body, regardless of where the problem is, right? So whether I've got a lung problem like asthma, or whether I've got a brain issue like depression, that on a cellular level, there's similar recommendations around, all right, what am I feeding my cells? So what kind of nutrients am I putting into my body? What am I doing for exercise? So how am I moving my body and my muscles? Because that has an effect on cellular function. And also stress management, right? Because we know that stress is, has this knock-on effect for physical health. So what am I doing to manage my stress? Am I meditating? Am I, planning things that I enjoy? Am I taking time off? Getting into therapy if that's going to help you manage stress. So all of those sorts of things are really important, regardless of the part of the body where we're having problems. Okay, so that wraps up sort of the big five about our physical and mental health. If you've got any questions, if you want me to talk about anything in my future vlogs, please let me know. You can chat with me via my website, mindfulrecoveryservices.com, or you can get me on Instagram, Facebook, all the usual places. All right, I hope you all stay feeling really, really well. Bye.